This video will provide you with a brief introduction to CultureVision and how to use it, familiarizing you with the various features available throughout the site. CultureVision provides on-the-spot access to information that can assist you in providing culturally competent care for your patients at every point of contact with your healthcare organization. In order to get the most out of CultureVision, you must have the necessary awareness of and training in cultural competence concepts to direct an inquiry appropriately and effectively. So we strongly recommend that you participate in comprehensive cultural competence training. There are many training options available, both in person and online, that will help you to maximize the utility of CultureVision and ultimately make it an essential part of your organization's sustainable efforts towards providing culturally competent care. After logging in, you will arrive at the subscriber landing page, where you will see a list of important points to remember while navigating the content on the site. Click on any of these topics to learn how to use the tool more effectively and to gain a better understanding of Western biomedicine culture. You will also find a sample cultural assessment questionnaire, as well as basic background information on communication in a multicultural environment and translation and interpretation tips. Please keep in mind that CultureVision should be used as a tool for directing an inquiry. It should not be used to form stereotypes based on a person's culture. Each and every individual has a unique cultural blueprint. CultureVision provides questions, not answers. CultureVision contains 3 menus to access information about diverse ethno-cultural groups. The first allows you to select a group based upon a patient's ethnicity. The second allows you to select by religion. And the third provides access to information on additional group or communities. For example, to learn more about the Latino community, select Latino from the Ethnicity menu. The screen now reveals the group overview in the center pane, as well as categories of information in the left sidebar. The content is organized into categories covering the cultural, biomedical, socioeconomic, and psychosocial factors that affect people's health status and health practices along the life cycle continuum. Click on any category to view the subcategories of information within it. Let's assume that you are treating a Salvadorian woman who has recently immigrated to the U.S. and you want to know the common illnesses prevalent in this community. You can use CultureVision to access this information easily. Select the ethnicity, Latino, then choose the illness-related issues category, and then the common health problems subcategory. The center content pane now displays common health issues that occur in the Latino community. As you scroll through the information, you can see that diabetes is a common problem among Latinos. Continuing down the screen, you also see that Latino women are at an increased risk for both cervical cancer and osteoporosis. To identify the other relevant issues faced by this community, you can click on Immigration Issues. This section provides information on acculturation challenges, as well as common infectious diseases and other contextual issues. For cultural perspective on chronic illnesses, potential problems, and attitudes towards healthcare, click on Concept of Health. You can also learn about your patient's cultural context, specifically around health promotion and disease prevention. The information under Diet and Nutrition category gives you some background about traditional food beliefs, as well as usual diet and customs and patterns, which may be helpful while working with the patient to institute lifestyle changes. Before prescribing medication, you can learn how your patient's attitude towards medication might be affected by their ethno-cultural background within the treatment issues category. Communication barriers often lead to incorrectly prescribed medications and treatments. Knowledge of cultural norms around communication styles and health literacy is essential for providing culturally competent care. The information under Language and Communication can help you minimize potentially harmful communication gaps that may exist between you and your patient. You can also gain insight to your patient's potential perspectives on health and their experience with health care by accessing information on the Traditional Treatments page under the Treatment Issues, as well as the Access to Care and Health Disparities subcategories under Illness-Related Issues. If your service area expands to include a sizable Cambodian community, Culture Vision can guide you to more information about the culture and health status of this community. In the Select by Ethnicity menu, select Cambodian. The main page for this ethnic group provides historical, cultural, demographic, immigration, and socioeconomic information about the community. Notice the additional resource links at the bottom of the page. You will find such links throughout the site. To learn more about the influence of the community's religious practices and beliefs, click on Beliefs, Religion, and Spirituality, and then select Beliefs and/or Practices that may affect healthcare decisions. It is important to ascertain issues arising due to immigration before beginning medication. Select the Illness-Related Issues category, and then select Immigration Issues. You can see that in Southeast Asians, hepatitis B is an important concern. This information is essential to ensuring that patients are screened and vaccinated appropriately. While treating Cambodian patients, you may want to understand potential neuropsychological issues, particularly in the context of their pre-immigration issues. To do so, click on the Mental Health Issues category and then select Neuropsychological Issues. Pharmacogenetic research has uncovered significant differences across ethno-cultural groups in the metabolism, clinical effectiveness, and adverse effects of many clinically important agents. Culture Vision provides access to the most relevant, up-to-date pharmacogenetic information. To learn more about this complex topic, select Ethnopharmacology under the Treatment Issues category. You can even take a brief quiz to test your basic knowledge about this group. The information provided in Culture Vision is thoroughly researched and constantly reviewed and updated. You can view the list of close to 2,000 sources. In addition, Culture Vision provides an extensive glossary. You will find direct links to these citations and glossary terms throughout the site. Culture Vision also provides access to up-to-date information about torture survivors and refugees, and a page with links to recent news articles about relevant cultural competency issues. It is important to remember that the data provided here must not be considered exhaustive. Individual differences among patients occur depending upon their socioeconomic status, education, rural or urban residence, the region they come from, their level of acculturation, and of course, their personal history and life experience. It is important to integrate all this knowledge when using Culture Vision so you can avoid the natural tendency to stereotype. You can use the Common Questions to Ask section to help identify your patient's particular needs and concerns on a case-by-case basis. When reading about different cultures in Culture Vision, we encourage our users also to take the time to develop self-awareness about your own assumptions, beliefs, expectations, and attitudes. Culture Vision is a work in progress. We always encourage users to share feedback and invite you to share your experiences with cultural competence in healthcare. To do this, click on the Send Us Your Feedback button, or you can fill out an anonymous survey. To learn more about Culture Vision and how your organization can benefit from it, contact us at www.crculturevision.com.